Welcome to Every Mom is an Athlete, the podcast where we believe motherhood is inherently athletic. From lifting car seats to chasing toddlers, your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, and mom of three. This is your space for strength, recovery, and real talk in pregnancy, postpartum, and motherhood. Welcome, Strong Moms. You're in the right place. Hello again, Strong Moms. We are back today talking more about pains during pregnancy, and today we're going to focus on rib pain. We're going to talk about why it happens, what actually helps, and also what not to do. So I hope you've been enjoying this series. If you haven't listened to the last couple episodes, we covered sciatica and also pubic bone pain, so go back and check those out. I'm not sure how many more we're going to do, honestly. I want to really cover the top things that I see, the top complaints from pregnant women that I see in my office. And I basically only see pregnant and postpartum women in my chiropractic practice now. I mean, I see the occasional man and I see the occasional woman that has just been with me for, my 15 years in practice off and on. But I just love helping pregnant women. And it's just so rewarding because, as you know, if you've had a baby, it's such a difficult time in your life. Your body is constantly changing. I tell the moms that come into my practice, it's hard to make a plan during pregnancy. If you came in and you're like, I have a shoulder issue, I would do all these orthopedic tests. I would do these functional tests. We'd look at your range of motion. I'd say, hey, this is what's going on with your shoulder. Here's your game plan. It's going to be this many weeks. Here's your exercises. We're going to check back in a week or two, whatever, right? It's very specific. Pregnancy is so different because it's literally every week your body's different. So anyways, all that to say, keep these episodes on hand because if you're pregnant, you might end up having a pain down the road. It might last just a little while, but I want you to have all the resources you need. Enough about that. Let's get into rib pain during pregnancy. All right, so let's talk about what you might be feeling if you're having rib pain. Lots of times I hear moms say that they'll feel like their baby is elbowing them in the ribs all day or that they're kicking them in the same spot in the rib. And I did have that when I was pregnant. I don't remember which kid it was, honestly, probably all of them. But it's very common in that kind of end of the second trimester into the third trimester. And again, if you listen to any of these episodes, you've heard me say this, but I'm just never going to stop saying this. Just because you're having some kind of pain, don't dismiss that as oh, it's just pregnancy. That's what happens. I hear patients tell me that their doctors say that all the time, and that's just not an acceptable answer, in my opinion, when there's so much that a chiropractor like me, a PT, even this is why I developed my at-home plan for all these issues that you can solve on your own. So you don't just have to live in pain. I'm not going to stay on my soapbox here too long, but there are ways to at least decrease all of these issues and make you a little more comfortable so you can enjoy your pregnancy a little bit more. Lots of my patients will describe their rib pain as either sharp or stabbing kind of underneath their ribs. Some people will get a burning sensation or even a tingly sensation sort of along their bra line. With my first son, I remember right underneath my bra line on the front basically went completely numb. And that wasn't necessarily from a rib issue, but there's just so much going on. There's so much stretching. You have to remember you have all these little nerves through there. And as they get stretched, they can cause different sensations to occur, like that numbness, that tingliness, sometimes that burning sensation. And that can happen all the way around the rib cage. Remember, they attach in the front at our sternum, so right in that chest bone, and then all the way around in the back to our spine as well. Oftentimes for moms, the pain can be worse on one side. So if your baby really hangs out on your right side, that can be something that causes the ribs to be more sensitive on that side. And what I hear patients say is they'll have pain with either sitting for a long time, driving can be a bad one, reaching up overhead or out in front, kind of with a twist, and even sleeping in twisted positions. So we'll kind of talk about some ways to alleviate those issues or those pains. But just know that again, you don't need to just push through this. There's so much that we can do. So why do we get rib pain in the first place during pregnancy? This is multifaceted. So the first thing I want you to remember is that your abdominal muscles are actually connected to your ribs. I think a lot of women maybe don't know this or just you're not thinking about it, but the abdominal muscles connect to the ribs, to our lower ribs, okay? And then obviously they go down and then they connect into our pubic bone. So this is where if you have pubic bone pain or rib pain, you start to think, oh man, think about how much your abdominal muscles are stretching. They really can pull and crank on those bony structures, the ribs and the pubic bone. So that's one reason. The other thing is that our rib cage during pregnancy expands up to 2 or 3 inches. And that's completely normal, but it can cause some pain, right? It can cause some pulling, that kind of like stretching feeling because things are actually moving and stretching and elongating. And that whole rib cage's bony structure is changing position. So you can understand why that might cause some pain as well. The other thing, I already sort of mentioned this, but is like the positioning of the baby, right? So baby's feet, their knees, their back can be pressing into your ribs. And this is especially common if your baby is breech or transverse. So that means either the head is up, right? When head is supposed to be down towards your pelvis, or if the baby is lying transverse. And sometimes even if they're posteriorly positioned, that can also just cause a little bit of additional rib pain I've seen. And then the other thing we need to think about is posture, right? And breathing changes. So we start to have the rib flare increase. Lots of women end up breathing more with their chest because your diaphragm sits right underneath your ribs, okay? And that's your main breathing muscle. And so what happens is as your baby grows, as your belly grows, that diaphragm starts to get kind of crammed up in there and it's not able to expand and contract in the same way. So we end up using our accessory breathing muscles, which are the muscles up in our chest, in our neck. And so that's where people can end up with more neck pain, more chest pain, and those muscles around the ribs, our intercostal muscles, those aren't getting expanded and contracted like they're used to. And so that can be another way that things sort of just like get locked into place and can become sort of painful. All right, so let's start talking about what everybody wants to know, right? Like, what do we actually do to help with rib pain? The first thing is breathing, right? And it sounds sort of silly, but I want you to go ahead, if you can, obviously, if you're driving, don't do this now, but put your hands on your ribs so that your hands are on both, one on each side, right? So they're on the lateral side of your body. You can hear, maybe I'm doing it now, I'm like shaking myself around. And then what I want you to do is really try to breathe out into your hands laterally, okay? So we're thinking about 360 breathing, like breathing all the way around the rib cage. But I find if you really focus on that lateral breathing, the posterior and the anterior will kind of come with that. So instead of having women just focus on like, really puffing that tummy out as they take their big breath in, I like to have women focus on expanding the rib cage laterally because then you get more of that 360 breathing without having to like think too much about it. And what I had women in my office tell me before while we're doing this is that at first it does feel a little bit worse. Like it does sort of like, it's like this kind of like, ooh, I don't know if that's good. That's like a weird stretchy, but you have to remember it's just breathing. Okay. And so what I usually have people do is go through like 4, 5, 6 nice deep breaths. And usually what will happen is that tension that you feel at the beginning will start to decrease and it will actually start to feel good and feel relieving and alleviate some of that tightness and tension that you feel through those ribs. As you're breathing out with this breathing, so you take your nice breath in laterally, right? As you breathe out, one cue that I like is kind of like if you were like trying to fog up a mirror, like, that sounds like a dragon. That's what you want to do as you're breathing out, because then you're really getting that full expansion of the ribs all the way with the breath in and then all the way out. And that's also going to help you reduce the rib flare, right? That's another thing that I hear a lot from patients who are postpartum. They're like, oh my gosh, my ribs expanded. Now they're all flared out. And then, we have to work on that, which is, by the way, a very fixable thing. It just takes some work. It takes the right exercises. It takes the right breathing, cues, all that stuff. But you can work on decreasing that while you're still pregnant by working on this full 360 breathing. The next thing I always recommend is be more aware of your posture during pregnancy. You really want the ribs stacked right over that pelvis. And that's where we talk about the transverse abdominis. I talk about this all the time, but if you think about, you have this big flat abdominal muscle that like wraps around both sides, kind of like covers your whole core. That's your transverse abdominis, okay? I find that you can feel it best right on the inside of the hip bone. So if you take a big breath in, as you breathe out, and you try to pull your two hip bones together, you'll feel that muscle engage. It's harder during pregnancy, but that is what we work on so much. And if you are cueing that, you're going to be in a much better position with your pelvis right underneath you. The other thing you want to avoid is like if you're doing a lot of weightlifting, you really want to avoid that kind of like chest out position because again, that's going to increase the rib flare. We do that a lot in weightlifting especially with some of the Olympic lifts. You really want that like big broad chest out. During pregnancy, that's not the time to work on that positioning. So I always have women, not that you're definitely not trying to suck your stomach in. Okay. Don't hear me wrong here. I just want your ribs pulled down towards your pelvis. The other thing is to make sure that you're not skipping out on the upper back mobility. I think during pregnancy, we tend to get so focused on like how tight our hips are, but really your upper back takes a lot of the brunt of it. So many women, I can't even tell you. I don't want to say every pregnant patient, but probably basically every pregnant patient, that upper back towards the end of pregnancy, it's just so much pulling forward as your chest gets bigger, your belly's bigger, and then baby comes and you're like holding and nursing and you're just so rounded forward. So that upper back just really, I encourage you not to skip the mobility there because that can just go so far in decreasing your pain and also allowing you to have this better posture, not get into that ribs, like kind of flared position, that sort of thing. As far as what does that mean? There's so many thoracic rotation mobility pieces that you can do. Child's pose with like a nice deep breathing, like a seated thoracic rotation, a gentle side bend. All those things are going to feel really good, but they're also going to open up through the ribs and allow you to get a little bit more movement and help decrease pain. Other things that can help as far as like support, people always want to ask about support. So belly band support, for this, obviously we're not talking about the band that goes around your hips, but more of just like the kind of like elastic band that goes over your whole belly. That can be helpful. I definitely don't want women using that all day. I generally recommend it if you're up and walking around, if you're working out, like if you're standing for a long time, like if you're making a big meal in the kitchen or something, or like at an event, that can be a really good time that you get that little bit of extra support. But I don't want people to become reliant on that sort of thing. The other thing is just making sure that your sleeping position is good. So if you're on your side, you have either a pregnancy pillow or some kind of pillow between your knees, that your neck is supported, that your upper body's not all twisted up. So sometimes I'll even have women put a pillow. Let's say if you're lying on your right side, I'll have them put like a small pillow under their left arm because then they don't bring that left arm across their body, if that makes sense. That's going to like twist you up a lot too. And another thing would just be changing positions, right? Just trying to make sure that if you're working and you're seated, that you can get up, you can stretch, maybe stand for part of the day. If you're at home, use a yoga ball to sit on, like just changing positions. Because again, posture is dynamic. And so we talk about good posture, but what that really means is like moving around throughout the day and being in different positions can alleviate a lot of these symptoms. Okay, real quick, I want to talk about what doesn't help, things that I've heard in my practice. So just stretching can actually be detrimental. So just stretching isn't necessarily the best advice because you have to remember your body's already super mobile, right? And so I really like foam rolling. I like to have my patients get into their lats, foam roll those. A more specific targeted technique is better than just like stretching your muscles in general, and especially during pregnancy. Ignoring the pain like it's just baby growing, please don't do that. Again, there's so many things you can do. The other thing is just like bracing your core all day. We want to have things dynamic. So I would rather than you're just like constantly bracing, I would rather you work on a lot of the breathing techniques. And that way you're getting some of that bracing in, you're engaging those muscles, but you're not like sitting in like totally braced all day. And real quick, I just want to make sure that there are some red flags, right, around rib pain. So if you're having like sudden or severe pain, or if your rib pain is accompanied by a headache or visual changes, nausea, high blood pressure, those are all reasons to talk to your doctor right away. Also, if it's on the right side, you definitely want to mention it to your doctor because you want them to be able to rule out any gallbladder or liver issues that might be going on. So if you have any of those, just be sure to mention it. It's always good to mention it anyways, of course, just to make sure that you're ruling things out. All right, I hope this has been helpful. Just remember, rib pain is common, but you do not have to just deal with it. There's so much you can do. If you're looking for more help with pregnancy pains and alleviating some of these pains at home, check out my pelvic pain fix plan. It's not just for the pelvis, it's also for your upper back, for your low back, for your hips. It's basically all the issues that I'm putting into these podcast episodes and then gives you a step-by-step, like here's how you reset your hips, here's how you mobilize your back, here's the exercises you need to do for like each specific one of these issues. So check that out. We'll put the link below. But just remember, you don't just have to deal with it. You deserve to enjoy your pregnancy as much as possible, as much as we can. And I'd just like to give you a quick reminder that your body isn't breaking down. It's just changing. It's adapting. It's going to be different each week. And that's why I'm here to help you work through these things and adapt with it. So until next time, strong moms, have a great week. Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder that you're still the athlete you've always been. If this episode resonated with you, I'd so appreciate it if you'd share with a friend or leave a quick review. It helps more moms find the support and information they need. See you next time.